Perfect. So A, thank you so much. So the answer is diaper tables. So diaper tables need to be, thank you, perfect, Carla. Diaper tables should be disinfected and not sanitized because diaper changing tables could possibly have those high hazard body fluids, which are blood, vomit, feces, and urine. So again, Sining will put in the chat where you can click on that link, and then that will lead you to the link that you can print these out and then put them on those 3 bottles: wash, rinse, and disinfect. Okay, so that was just to get your brain cells moving as we get started here. Welcome to our ECE partner meeting. Today we'll do some introductions. We'll talk about the updated How Sick is Too Sick. We'll look at respiratory disease season, what we are expecting. We don't really have a crystal ball, but if we did, this is what we're expecting and forecasting based on previous data. We'll look at RSV, COVID-19, and influenza. And then for reporting, many questions that I've had in the Health ECE inbox have been, what is the updated COVID-19 outbreak definition? And then summary, we'll talk about best practices to prevent the spread of disease, and then 5 ways for you as staff to stay healthy this season. So let's get started. So I'm Martha. I'm an epidemiologist and dietitian, and I'm the person that answers the Health ECE inbox, so any of your communicable diseases, and I work closely with Sining.
Hi, everyone. My name is Sining Chan. My pronouns are she, her, hers. I'm the new outbreak epidemiologist. I started with Boulder County about 2.5 months ago. So while Martha is the face of Health ECE, I kind of do the background work on the disease prevention side. So a lot of the paperwork and stuff and the communication through CDPHE.
So we're super happy to have Sining. And sometimes if I'm gone, she'll be answering the Health ECE inbox as well. Okay, so since we're talking about the updated, so as a kid, I loved to play those games where you would compare 2 pictures and spot any differences. And as you know, we're using this as an example because the How Sick is Too Sick policy has been updated. And I don't know if you remember what the old one looks like, but there's been some changes in the new one. So I just want you to look at these 2 pictures, the left side and the right side, and it's a vegetable frenzy, and there are actually 7 differences. So if any of you want to put some of the changes that you see or the differences in the chat, feel free. Or if you want to unmute yourself, that would be great too. So what differences do you see? They're very subtle differences. Okay, carrot missing on the top right. Yep, so there's a carrot on the right side and not on the left side. Excellent. Nicole, thank you. Color difference of pink versus yellow in the middle-ish from Sheila. Color even the pink. Yep. So this one's pink, this one's yellow. Excellent. Okay, sesame seed missing on top left. Excellent. And that's actually a couple of the differences. Yeah, the one here is missing. Perfect. Okay, excellent job. But the goal was to see, okay, sesame seed missing on top left. Perfect. Okay, so let's see what they came up with. So you can see all of these circles here are the differences. So we got the carrot one, the color of the carrot one there. Here is a difference. And then here the sesame seed, and you can see here the sprout or the onion goes down, and then sesame seeds there. And Jane says, I'm impressed with the eagle eyes you're all displaying. So the How Sick is Too Sick was updated. And we want to encourage you to purge all of your PDFs and to use the link that Sining will be putting in the chat. If you just save the link, then you always get the most updated and current information. There's been some questions recently with RSV, with what's the exclusion, and the current recommendation from CDPHE is 24-hour exclusion. You as a facility, of course, can choose to increase based on your experience and understanding your experience, but understanding your facility, but currently the exclusion is 24 hours. And also how sick is too sick has been simplified, we think, is not COVID focused. And the question to ask yourself is, does your child require more care than normal? So there's the link that Sining put in the chat is here. And you'll also notice an update has been, you can just click right here and it will be translated into Spanish, which is wonderful. And then going back to, it's important to look at what are some reasons that children and adults should stay home. Is number 3 here, if a child needs more care than teachers and staff can give while still caring for the other children. So it's important to note that you as directors, have the right to say if this child is just taking more care, it's okay to send them home, even if you get parent pushback. You can refer to this how sick is too sick.
Perfect. Thank you, Martha. I also dropped a little picture into the chat as well. How sick is too sick? This goes to show you should always use the link because I haven't seen this and I just opened it up, but it's now been translated into several other languages as well. So yeah, we wanted to take this time to kind of see what illnesses you all have been seeing recently at your facility. I know that both of us have been in contact with some of you about some increases in illnesses, but it's good to just see and share what other facilities are seeing. And yeah, if anybody wants to type in the chat or unmute, now would be a great time to share kind of what's going on.
Yeah, 24-hour stomach bug. Yep. Illnesses causing our clients to cancel. COVID, hand, foot, and mouth, general fevers. Yeah, we've been seeing a lot of that.
Okay, perfect. Well, thank you, Jane and Jenna, for both sharing. As we know, it is respiratory disease season. So, of course, we're seeing a lot of increase in, like Jenna mentioned, COVID. We are seeing fevers that are often associated with respiratory disease as well. A lot of facilities are mentioning cough, croup, stuff like that. So, as we all know, respiratory disease season kind of falls in the fall and winter seasons every year. And we see this uptick in respiratory illness happen on a yearly basis. So I just wanted to share some resources here that we use as epidemiologists to kind of see what's going on in the community. We do have our national data. This is shared by I believe this is CDC, but they have kind of an outlook of what respiratory illnesses are looking like across the nation. If we're looking at it from more of a local point of view, Colorado has several different resources that we like to use. So CDPHE has their viral respiratory disease dashboard. It is updated on Wednesdays, and actually all of these Colorado resources are updated on Wednesdays. Just a coincidence. I don't think they planned that at all. But yeah, so the CDPHE viral respiratory disease dashboard is updated weekly, gives you an idea of how many people are testing, what kind of hospitalizations, even outpatient visits that look like influenza-like illness, they have numbers for that as well. We love using Children's Hospital Bug Watch when we're looking specifically for ECE related illnesses. This is obviously for this data comes out from Children's Hospital, so it's more specific to the age groups that you all are working with. And then finally, our COVID-19 wastewater trends are really useful that come out from CDPHE. As you all probably know, there's not a lot of people that are testing anymore for COVID. And so our wastewater trends are the best source that we have to understand what's really circulating COVID-wise in the community. We do have a lot of people that are still using at-home tests, but those aren't reported generally to the state or the local health departments. And so those are do not usually show up in dashboards such as the viral respiratory disease dashboard, but our wastewater trends give us a good idea of what's circulating COVID-wise. The CDC did give us kind of an outlook of what our respiratory illness season might look like this year. Of course, that's still, like Martha said, we don't have a crystal ball, but the CDC is kind of helping us out with that. So they are predicting that there's going to be a similar number of hospitalizations due to respiratory illness compared to last year. This, of course, we know was higher than pre-pandemic levels, much of it due to potentially, lowered immunity just from the pandemic. Some of it due to, removal of community mitigation practices and stuff like that. So we're expecting to see that COVID-19 is going to cause a semi-moderate wave of hospitalizations similar to last year, again, primarily due to population level immunity. And then we are seeing, people having prior infections and getting vaccinated. So it should be pretty moderate, not mild, not high, but kind of somewhere in the middle. Influenza is anticipated to have a typical season, nothing too crazy. And then RSV is expected to return to normal. We know that last year we had a pretty high pattern, or pretty high incidence, or pretty high numbers of new cases of RSV that popped up last year, as you all were seeing in your facilities. So this year we're expecting to see that kind of drop back down to normal levels, especially with our new immunizations that are available to both older individuals and then our young kiddos and infants. Yeah. Perfect. And then here we have a couple graphs from Bug Watch. Like I said, these are the graphs that we like to look at when we're looking at what is affecting our ECEs and even our schools. So you can see here that COVID is on the rise in the last 8 weeks, as well as our influenza, and our RSV. This is not atypical. As I said, we see this happening every year, so nothing too alarming. I know that in these graphs, you can't compare them to what last year's looked like, but it's looking like a pretty typical season of RSV and COVID and flu. So Bug Watch also lets us know what kind of enteric pathogens. So those enteric pathogens are ones that cause diarrheal-like illness. So Bug Watch also gives us a graph to help us look at what's circulating from a diarrheal illness point of view as well. We can see here that we are seeing diarrhea viruses increase. And so I know that Jane mentioned that 24-hour stomach bug. We are seeing increases of gastroenteritis and norovirus happening as we do typically this season as well. So again, nothing too alarming, but just something to look out for if you are seeing diarrheal illness increasing in your facilities. Any questions so far? I know that's a lot of information from epidemiology wise, a lot of numbers.
Sining, I was wondering if diarrhea would this also include vomiting? The two often.
That's correct. Yeah. So norovirus presents differently in adults versus kiddos. Adults typically you tend to see more diarrhea and then, or sorry, I think it's the opposite, maybe. Diarrhea you see more vomiting and then kiddos you see more diarrhea. So just, something to look out for. Yes. We like to call that gastrointestinal illness. So it's either coming out through the mouth or the other end. So,
one end or the other or both, right?
Yeah, exactly. Or both sometimes. Yeah.
Thank you, Sining.
We have a question. It says, is there different guidance for sending children home for this? I'm assuming you're talking about gastrointestinal illness. Is that correct? Yeah, perfect. Yeah, for general GI illness, our typical guidance is to exclude for 24 hours past your recovery from said illness. This might differ depending on the diagnosis. So if you have a norovirus diagnosis, typically we recommend, specifically for norovirus outbreaks or cluster, we recommend that exclusion goes up to 48 hours, but typically you're going to see a 24-hour illness exclusion. And this is all on how sick is too sick. It's really good. I think the way that they've laid it out now is via they kind of divide it into what kind of symptoms you're seeing. And so if you don't have a diagnosis, you can just look at, what kind of symptoms am I seeing in my facility and exclude based on those symptoms. What about sending a child home from care? We understand that that can be difficult given, parents are at work or, other things like that. If you are seeing above average diarrhea, so I know that kiddos are having, diarrhea all the time, but if you're seeing, something above baseline, we like to use the word baseline a lot. So anything above what you typically see from that child, we would recommend sending them home. And then we have another question. How many cases does a facility need to bump up to that 48 hours? So with a norovirus diagnosis, you are going to typically see a lot of cases. It's hard to get a norovirus diagnosis, so it becomes a little iffy here, but most practitioners don't test for norovirus just because, one, it doesn't lead to super severe illness. And then two, you can usually tell it's norovirus just by the way that it is. You're going to see the diarrhea and vomiting, and it's going to end within 24 hours. And so usually people aren't going to see their provider if something goes away within 24 hours. And if they do, the provider is just going to say, if it goes away in 24 hours, it's probably norovirus. And so typically we identify a norovirus outbreak just by looking at the trends. So if you're seeing a lot of diarrhea or vomiting illness that is a duration of around 24 hours, and you're seeing a lot of illness, norovirus is very, very contagious. And so you're going to see that blow through your facility, as I'm sure a lot of you know. So it's really, we bump that exclusion guidance up as soon as something in our brains are like, ooh, that looks like norovirus, and so that's a definitely really good situation in which you reach out to Martha or I through Health ECE, and we can kind of walk you through what that looks like. That's a great question, though. Perfect. Okay, awesome. Back to respiratory illness. So what words come to mind when you think about respiratory illnesses? We can think about symptoms, diagnoses, anything that comes to mind specifically for you all.
Contagious.
Contagious is, yeah. Cough, fever, COVID, RSV, flu. Yeah, great, Amy. Airborne pathogens, I like that. Yeah. Perfect. And so we put together this little word cloud here that you might see some of those words that you think of when you think about respiratory illnesses. I don't have contagious in there, so that's a good one, Mary. But yes, you're right. A lot of these are contagious, and that's usually through droplet transmission or through airborne transmission. And so, yeah, and so a lot of these respiratory illnesses are transmissible from person to person. Okay. And I think, as you all know, a lot of these respiratory illness start to look the same, right? So we don't necessarily know if it's COVID, if it's RSV, if it's just a cold or some sort of flu or something like that. So when we are looking out for respiratory illness, we're watching out for specific symptoms. We're looking for cough, runny nose, congestion was mentioned, fever, headache, upset stomach. The upset tummy is more with our younger ones, I believe, is we see kind of like a crossing of these symptoms of GI illness and then also the respiratory illness. What's really important, like I said, it's hard to get a diagnosis for any of these. But what's important is that you refer to how sick is too sick for your exclusion guidance. I know that we've mentioned that like 3 times already today, but again, it is important. If you don't have a diagnosis, there are still exclusions that are in place for certain symptoms. So always refer to how sick is too sick for how long you should be excluding based on symptoms. And then the other thing to consider when you are excluding individuals from your facilities is, are symptoms more severe than normal? Is your capacity being stretched? Is your ratio for licensing, there are licensing requirements for your ratio of staff to students. So is that being pushed as well? Do you have more staff out than usual? So, exclusion may be based on, more than what how sick is too sick is telling you, but also based on what your capacity is at your facility. We have been seeing some RSV circulating around, so we wanted to give you some fast facts for RSV. We know that last year we had a huge spike in RSV, and so that I think that there is a lot of, cautiousness around RSV this year, which we don't, nothing wrong with being cautious. But just wanted to remind you that RSV is pretty common among individuals, especially our little ones. Almost all children will be infected with RSV by their 2nd birthday. That's not to say that they're going to have more severe symptoms or what exactly the RSV is going to look like, but just to remember that, one case of RSV is not necessarily, while we would still love to be communicated that information, is not necessarily a sign to, raise the alarms or anything like that. It is extremely contagious, so remembering to stick to that 24-hour exclusion. And then, there is a chance that 2 to 3% of kids will end up in the hospital. So just, exclusion is to make sure that you're not, that there's not spread happening in your facility. So while one kiddo might have pretty mild symptoms, it is possible that others might still have more severe symptoms. So that's why we ask you to exclude for RSV-like illness. The only way to determine if it's RSV or not is through a diagnostic test. And so, again, we recognize that that's not always available to kiddos and to our parents as well, or even you all. So, again, going back to excluding based on illness or based on symptoms. We are going to talk about the shortage of antiviral or we have plans to talk about that. We are not super familiar with what is going on. We do know that there is a shortage of monoclonal antibodies for RSV for infants. I'm not sure if that's the same thing that you're referring to, but there's a shortage kind of at a national level. And unfortunately, we don't have great resources for that right now. We are kind of still communicating with our immunization team about that shortage in monoclonal antibodies. Yeah, so I was just talking about RSV immunizations. There are 2 immunizations that have just been approved. So we have our RSV vaccine, and then we have RSV monoclonal antibodies. The difference between the 2 of those is that one gives you what they call active immunity, so you produce your own antibodies, and the monoclonal antibodies is just an injection of antibodies, so that's called passive immunity. And typically with passive immunity, you have a shorter protective period. So we're seeing with our monoclonal antibodies, specifically for our infants and our young children, so anyone going into their first RSV season, and then our more high-risk infants going into their second RSV season, that protection only lasts up to 6 months. So that's just to say that if they are receiving monoclonal antibodies, that doesn't mean that they won't need them again the following season if they are at higher risk. Our vaccine is specifically for our individuals 60 and above, because we see that age group is more susceptible to more severe illness and hospitalization, and then also our pregnant individuals. So pregnant individuals are recommended 1 dose during their weeks 32 to 36 of pregnancy, and that's specifically so that they pass on that immunity to the child, their child. And so they then confer more immunity for when they're going into their first RSV season. We have had some questions about if the RSV vaccine or immunization can be co-administered with your flu or your COVID vaccination, and it can be. So you are all good to get all 3 if you are qualified for all 3 of them. And then we also have our updated COVID-19 vaccine. This vaccine has been changed, altered from our last vaccine just to be more effective to the current circulating COVID-19 strains that we're seeing. Anybody 6 months to 4 years old is recommended to get an updated vaccine, as well as anybody over 5 years old. But the recommendations might just look a little bit different depending on how old you are. Anybody on this call, though, would be recommended to get an updated COVID-19 vaccine at least 2 months after getting their last dose. And then we know that there has been, a shortage of access. There's no longer those COVID-19 large vaccine clinics that we were seeing during the pandemic. So we are referring people to their providers. However, if there are individuals that are underinsured or uninsured, there is something called the Bridge Access Program, which provides free or low-cost vaccines. The no-cost vaccines, you can go to any of these I guess 3 options listed here on the slide. You can go to vaccines.gov, and that'll give you more information on if the specific provider you're going to is partnered with the Bridge Access Program. I have a question from Jane. So is it recommended that we get a second dose of COVID vaccine if we've recently had one? If your last dose of COVID was not the updated COVID vaccine, then you should wait 2 months until you get the updated COVID vaccine. However, if you've already gotten the updated COVID vaccine, there's no reason to get a second one after that 2-month period. Does that answer your question? Yeah, perfect. If a person has had COVID, is the recommendation still to wait about 3 months before getting the updated COVID vaccine? Yes, that's correct. It's not. Yeah, that's correct. Yep, 3 months is, I believe, the most current recommendation. You should still have some immunity or natural immunity from your recent COVID infection. And so really, it doesn't hurt to get it sooner. It's just due to, there's not a lot of vaccines available. And so that's just to kind of spread out the administering of those vaccines. So if you get it earlier, it doesn't hurt, but it really, one, it doesn't make sense because you still have natural immunity, and then 2, it does save those vaccines for people who have not had a recent COVID vaccine. Yes, we are going to send you these slides, and we are recording this as well, and so those should be posted on YouTube. And Martha has already told you. Yes, Jane will send out the slides.
Great. Thank you so much, Sining. So wonderful to have her on our team. Okay, so some of the questions I've been getting asked in the Health ECE inbox is, are there some free COVID-19 tests? And unfortunately, the state's free testing program ended on July 31st of this year. However, if you're interested in more information about a bulk purchasing agreement, please reach out to us at healthece@bouldercounty.gov for more information. I think the bulk purchasing agreement is very bulk, so you'd need to have a large group of group of, or different organizations. So you might want to team up with your K-12 schools, ECC, BC, and other agency to purchase these bulk testing supplies using the bulk purchasing agreement, which Colorado Department of Public Health and the Environment has created. So if you're interested in some about bulk purchasing, please reach out to us. Okay, we'll move on to flu. I really like this poster that the CDC created. And you can see here there's a rhinoceros and a unicorn. And so the flu vaccine can take you from wild to mild. And if you want to, we put the link here as well. If you want to print that out and put it at your childcare facility, that would be wonderful to encourage families to vaccinate for the flu. And so flu vaccine, the recommendation of all persons ages 6 months or older who do not have any contraindications continues to be recommended. And ideally, you want to be vaccinated by Thanksgiving or any situations that you have large gatherings. And I always love to question. And so I wondered, does this flu vaccine actually work? I follow an epidemiologist. Her name is Caitlin Jetelina. She's called YLE, Your Local Epidemiologist, and she was actually invited by Biden to the White House to receive an award during COVID because she was excellent in explaining scientific information to the general public. And so, and she provides a weekly newsletter, so you might want to, you could email her and she'll add you to her newsletter. And so what she found is that the flu vaccine reduced work sick days by 1 to 3 days. And so this study was done in the United Kingdom. So if 1,000 employees are vaccinated for the flu, a business would reduce absenteeism by 220 days, and they should expect a return of $1.26 to $6.32 on every dollar invested by an employer. So again, depending on the severity of the flu that year. So I think that's a good example that reducing sick days by 1 to 3 days, especially in child care facilities, is really important.
Okay, so we have kind of a scenario for you all, and we know that this scenario probably sounds familiar to you. But the scenario is, okay, we have an infant with a runny nose. Your staff are concerned that the kiddos are the ones getting the staff sick. And then we also know that runny nose is one of the symptoms of COVID-19. Would you, as the director, choose to send the infant home? What's your response? We just want to let you know that there's no right or wrong answer here. It's just, we'd love to see kind of what you factor into making those decisions in your facility.
So lots of great answers in the chat here. Any other symptoms, change from baseline? How many children have this runny nose? Go ahead, Sining, if you can see the chat too. Sorry.
Yeah. And then Amy said, does the infant have any other symptoms, or does the family? Jenna said, for our babysitting service, our sitters care for kids who have a runny nose with clear discharge and no other symptoms. And then we also have questions, what are the other symptoms? Are they experiencing any other symptoms? Jenna also says, mainly we want transparent communication with parents so we can decide if is this a sick kid or just seasonal runny noses / getting over an old illness. Yeah, these are great points to bring up. We know that kiddos have runny noses all the time. So yeah, Mary bringing up, is this a change from the baseline? We love to use that word. Does it look any different from the day to day? Yeah, is the child seeming worse? Tired. Yeah, awesome. Minorly annoying, they can stay and keep an eye on things. Yeah, perfect. Yeah, absolutely. There is not enough information here. We agree. And that's why when you all come to us with questions, we always have more questions as well. There's a lot of different circumstances in which we might recommend different things. So it's always good to look at kind of the big picture and, how is this affecting your facility? Are you short-staffed? Is our staff overwhelmed? Stuff like that is also stuff to consider as well. Yeah, thank you all for sharing. Yeah, and so what we look at generally for exclusion, and what we recommend you all look at again is to follow how sick is too sick for specific illnesses. For specific diagnoses, there are different exclusions. So as we all know, I don't have any of these off the top of my head. So how sick is it too sick is a great resource for me as well. And then obviously with different symptoms you're seeing, we're not always seeing diagnoses. So, what symptom is above baseline, maybe the most severe, and going off of exclusion for that symptom. And then also, like I said, is you might want to consider if the child needs more care than you and your staff can provide, even if they're minorly annoying.
Can we use that for our children too, Jane? Minorly annoying. Or pets?
Yeah, and then we have a lot of questions about what's reportable. So for single individual cases, hospitalized cases due to influenza, RSV, and COVID-19 are reported to us, the LPHA or to CDPHE. So anybody who tests positive and is hospitalized with influenza, RSV, and COVID-19, those that information gets passed over to us. What we're looking for you all to report to us is kind of just clusters of illness. I know that we've had a lot of questions about what is the outbreak definition for COVID-19? And I wish I had a better answer for you, but the answer is it's been changed to above baseline, again, for your classrooms and facility. And so that's kind of just, if you are seeing an increase in COVID-19, maybe in a certain classroom, or, you, for some reason, you all took one classroom all took, or a few classrooms took a trip together and they're all starting to get COVID. That might be a situation in which we would like to be reported that higher number of COVID-19. So looking for some sort of pattern, is there a similar exposure? Are there similar events that are occurring in which you're seeing an increase of illness? We're no longer looking to be reported a single case of COVID-19. Even if you have like 2 or 3 cases that are all in different classrooms and are different ages, and if you're something like that, that's not necessarily something that needs to be reported to us. That for us looks like baseline. We know that there's community spread of COVID-19. We're expecting to see cases of COVID-19 in individual classrooms. But if you're seeing an increase in one particular classroom or in classrooms that maybe share particular activities, then that might be something that we'd want to know about. And of course, if you're not sure, just let us know, and then we can let you know if that if we do something with that information or not. It's always nice for us to know what's going on in the community anyway on your end of things. So too much communication is not a thing. We love to hear what's going on. And then as always, you can refer to your the illness Bible, as you might say, the infectious diseases in childcare and school settings. So there is a long list of illnesses that is in that document, and you can refer to that. For many of those, it lets you know when it should be reported to public health.
Okay, then let's focus on prevention. So how do you prevent the spread of disease in your facility? So I'd like to ask that to you all. If you could unmute or type your answers in the chat. What are some of the key things that you do to prevent diseases spreading from child to child, or from staff to children, or from children to staff? Hand washing, so much hand washing. Thank you, Jane. Yes, that's the #1 way to prevent illness from spreading. It seems like we talk about it so much, but we just all need constant reminders to rub our hands together for 20 seconds with soap. And Carla, sanitizing toys and doorknobs regularly, washing hands, super. Following the infectious disease manual for schools and childcare. Thank you, Jane, for putting that link in there. And then hand washing, HVAC filters. Thank you so much. Take a break. We'll be talking about that. So thank you for all your suggestions, and they fit in here. So some best practices: send reminders to families to stay home when sick. And you can even share the document about how sick is too sick with your families. It's public facing information. Educate about vaccines, Danielle just said in the chat. Thank you so much. I think the two things we as epidemiologists always recommend is hand washing and vaccinations are the two best ways to prevent the spread of illness. Stay up to date on vaccines. If someone is diagnosed with COVID-19, 5 days of isolation and 5 days of masking. Improve ventilation. So there we talk about if your HVAC person, heating, venting, air conditioning person comes to your facility, ask them if they can increase the number of air exchanges per hour in your facility. That can help. That's one way to improve ventilation, as well as opening windows and doors if that makes sense for your facility based on the weather outside as well. And then reminding children and staff about hand hygiene and respiratory etiquette, encouraging them to sneeze into their elbow and not into their hands. And then enhance cleaning, sanitizing, and disinfecting practices. Sometimes when I consult with different facilities, we brainstorm on what would be ways that for your facility we could decrease the spread. And sometimes washing toys daily, switching toys out, having some toys in a crate in a different room and then bringing them out for the day, and then optional temporary masking. And we talked here about staying up to date on vaccines. However, we've been seeing that children may need what's called, in quotes, catch-up vaccines. We noticed that during the COVID-19 pandemic that many children didn't go to their PCP for their wellness check. And often at those wellness checks is when children would receive their vaccines. And you can see here, I just listened to a presentation by the Colorado Department of Public Health and the Environment, and worldwide in 2021, 40 million children missed a dose of the mumps, measles, and rubella vaccine. So that's a record high. So think about that. We have a question in the chat. How about using an ozonator in the classrooms over the weekend? Do you know anything about those? You know what? I am not familiar with the ozonator. I don't know if anybody else on this call is. But we can.
Yeah, I'm not familiar either. I was just going to say that would be an air quality. And the only thing I would say is that we often look at the filter to make sure that's being changed. But I don't know any statistics on outcome for cleaning the air with such a thing.
Okay.
Jane, Kara.
Go, Kara.
I was just going to say that we learned a lot during COVID, and that ozonators are not at all recommended, because ozonator is a respiratory irritant. And so our air quality people had said that when you get any kind of air filter, to make sure it does not generate ozone. So
okay,
something to think about.
That's super helpful, Kara. Thank you. And just going back to MMR here, it's interesting that coverage of the 95% of the population is necessary to create and maintain community immunity. And worldwide, 81% have the first dose and 71% have the second dose. So it's so contagious, measles is. And so that's why it's so important to have 95% of people vaccinated against measles. Okay, this is ventilation systems. That's interesting for me. My husband is a heating, venting, air conditioning engineer, and so we talk about this quite a bit. And so this is another study. So does upgrading the ventilation system work, or even increasing the number of air exchanges per hour? This is another study done, or that was quoted by Caitlin Jetlina in the Your Local Epidemiologist. And in this study, 4,000 employees in over 40 buildings, twice as much clean air reduced sick leave by 35%, which is amazing, I think. And so by investing $40 per person per year to double the ventilation rate, employers can recoup $6,000 to $7,000 per person per year in higher productivity. So I think, to me, that shows upgrading, or at least increasing, making sure your filters are clean and increasing the number of air exchanges per hour.
All right, so Martha and I kind of put together, I know that was a lot of information, so we're going to break it down. 5 ways to stay healthy this season. 1, wash your hands. We talk about it all the time. Use soap and water, 20 seconds, sing the birthday song, make sure that is your first line of defense. 2, get vaccinated. We talked about RSV vaccinations. We talked about COVID-19. We talked about flu vaccinations for this season. Yeah. Definitely something to keep educating about, like Danielle said, and keep making sure that you're doing the best to protect you and the people that you work with. Again, talk to your PCP about RSV protection. That looks different for infants, or not infants. Yeah, for infants versus for adults. And then number 4 is to stay hydrated. We all know that drinking water and staying extra hydrated boosts your immune system. So that's another way to stay healthy. And then Martha is going to kind of delve further into number 5 here.
And let's take a water break as long as we're at it. I often try to fill a water bottle before a meeting and then finish it by the end of the meeting. Just little tips. Okay, and then boost gut health. So we really want to think about how can you as staff improve your gut health? And one way is through increasing fermented food and increasing the number of plant choices that you eat per week. And so since I have 2 hats, epidemiology and dietitian, I was at a conference a few weeks ago with 10,000 dietitians in Denver, and we got to learn about some of the updated nutrition information. And talking about gut health was one of the hot topics. And so if you think of your gut, it's actually all the way from your esophagus to your stomach, and then you have your small intestine in here, and then your large intestine here. And so what you eat can affect that whole microflora, or maybe you've heard microbiome before. It's another vocabulary word. And 2 ways to do that is to add more fermented food and to eat foods rich in fiber. So some examples of fermented food would be yogurt, kefir, kombucha. I'm still working my way up to enjoying kombucha. My daughters love it. Sauerkraut or kimchi to your diet can be a safe and tasty way to boost the diversity of the microbiome and to increase or decrease inflammation. And then the second one is eating more foods rich in fiber. And so these are fruits, vegetables, whole grain, nuts, seeds, beans, and lentils. And the study that we examined at this conference, published in 2018, found that people who ate more than 30 types of plant foods per week had a more diverse gut microbiome than those who ate up to 10 types of plant foods per week. So I want you to think about, it's almost 1 o'clock, and think about what you've eaten this morning from when you got up until now, and think about how many fruits, vegetables, whole grains, nuts, seeds, beans, and lentils you've eaten. So just think about that. I actually, in preparation for this talk, threw in a little bit of frozen broccoli, which I didn't, our microwave isn't working, and so I had to put hot water on it, and then I cut it up and put put broccoli in with my scrambled eggs. So it was one way to increase my fruits and vegetables. But if you think about it, how do you increase it by 30 types per week? And if you take 30 divided by 7, that would be, or divided by, 7 days in a week, that would be about 4 different types of fruits and vegetables in a day. I don't know if that sounds like a lot or a little, but please put in the chat, or feel free to unmute your good ideas with how do you boost your gut health. I'll share a few of them while you're thinking that we brainstormed with, if you make a salad, so that would be, the lettuce would be 1, and then add 3 different colors of vegetables to your salad, maybe tomatoes, green peppers, and carrots. So then you'd already have 4 in one day. What about other things that you do to increase your gut health? Kombucha, you'll have to tell me how you eat it or how you drink it, Kristen. Take a break. Love kimchi, wonderful. Hemp seeds, it's a good form of fiber. Stir fries, excellent. And you can see here in the picture, making smoothies in the morning. There was a 7-day smoothie. Oh, the Kelly, yep. There was a 7-day smoothie challenge with putting all sorts of different spinach and putting different mango, different fruits and vegetables together, and to make green smoothies. So we know that you work so hard in your childcare facilities, and we want to make sure you keep healthy and happy. I have a quick little video here. So I think all of you work with children, and you wonder, what will they be someday? And here's a father. His name is Dr. Drew Weissman, and he developed the messenger RNA vaccine against COVID and was just awarded the Nobel Prize for Physiology and Medicine in 2023. And here's just a really sweet 30-second video of how he's calling his parents. So I thought, as childcare directors, you might appreciate that.
Hi, it's your son.
Can you hear it okay?
No kidding.
Yeah. Rachel.
How you doing, honey?
Good. Rachel's also on the phone. Is Dad around?
Yeah, he's on the phone.
Oh.
Oh, sorry.
I have some news.
Shoot.
You're both on?
You there, Hal? Yeah.
I won the Nobel Prize.
Oh, my God. Oh, my God. Congratulations. Oh, how fabulous. I don't know what to say. I'm ready to fall on the floor. You kept saying, no, it's never going to happen. And you did it. And so young.
Yep.
Congratulations, sweetheart. You're the product of our hearts, Drew.
Thank you.
Congratulations, and you deserved it.
So I think you work so hard with all your kiddos, and you never know. Maybe one of them will be a Nobel Prize winner someday. So, okay. Well, this is the end of our presentation. And if any of you would like to receive a professional development certificate, please email us at the healthece@bouldercounty.gov inbox with your first and last name and your facility name, and I'm happy to send one out for you. And then just our bottom line, Sining and I and everyone through the Child Health Promotion team at Boulder County Public Health Our goal is to prevent the spread of disease, to keep your classrooms open, and to provide healthy spaces for children to learn and thrive. So we really appreciate your partnership. And then we just have, I think Amy's here. Would you like to share a little bit from the Early Childhood Council? You might have to unmute, Amy.
Thank you. Here I am.
Thank
you for that presentation. That was great. And that got me a little teary for a second.
Me
That
too.
video. I just wanted to share that EQIT registration is now open on PDIS for Boulder County. We're going to have 2 cohorts in the spring, as we as we usually do on Tuesday and alternating Saturdays beginning in January. And the registration is open. We are prioritizing Boulder County, people working in Boulder County programs, especially with infants and toddlers. We will open it up to the rest of the state after it's open to Boulder County. And if you do have staff that are trying to register on PDIS, please make sure that they have your program listed as their employment, because if their employment is not current and it doesn't match up to a Boulder County site, then they won't be able to see the sessions that are the Boulder County sessions listed on their account. So that's important. So if you're wondering why you don't see them, that could be a reason. Also, it's important that the teacher or staff person who is taking the class is registering on their PDIS account, because everything is done and certificates are issued through their PDIS account. And lastly, I'll put in the chat our website, and that has information about class dates and times, how to register. There's even a video on there and a how-to guide about how to register for PDIS if anyone is needing extra support on that. And I also wanted to share that our 23 to 24 Boulder County Quality Improvement cohort is now full. So we're excited to have so many programs join us for that. You can still get on the wait list if you're interested, and you apply through your Colorado Shines QRIS account. And one last thing is, I know it's 1 o'clock. I just wanted to say quickly that our Fall Pyramid Plus incentive program is opening soon. And we have a limited number of incentives that are being offered for people who have they have to have completed Pyramid Plus during the months of September through December 2023. So they have to have completed it. And we will have applications open on our website and more information December 1st. And I also know if you Pyramid Plus, I know Healthy Childcare Colorado, in partnership with the Department of Early Childhood, is offering, there's going to be more Pyramid Plus classes happening in early 2024, and opportunities to take them at no cost. So I'll try to put some of that info in the training calendar. But that's about it for now. Thank you.
Perfect. Thank you so much, Amy. And I'll let Jane close us out here.
Yeah, wow, lots of really great information. Thanks everyone for coming and for putting your heart and soul into taking care of our children. We do have another meeting in December that will be what we've been calling our healthy snacks. So Tori and Kyla will be given a presentation. I'll send out a reminder with the link when I send out the slides and the recording of this one. But it will be December 11th, Monday at noon. And the topic is on the screen: winter outdoor play for the children and their grown-ups. So it'll be fun. And that's it. We have a great Thanksgiving week next week, and hope to see you on December 11th. Have a great day.
Okay. Thank you, everyone. Bye-bye.
Great job, Martha and Sining. Sining, do you want to stop the recording?
Yes.
Or is it me? I don't know.